In South Africa is that we've recorded the fewest new COVID-19 cases since December 8, with 4,551 new infections in the past 24 hours. Now, of 26,113 tests, a positivity rate of 17.4. There have now been 1,417,537 total confirmed COVID-19 cases across the country now. For the latest on this, so we are with CoChair for the COVID-19 Ministerial Advisory Committee, Prof. Salim Abdool Karim. A very good evening to you, and thank you so much for speaking to us.
A very good evening, SABC, and a very good evening to all of the viewers.
All right, so I just mentioned that this is the first time since December we have had an infection rate in the 4,000s. Obviously, still sad that we're facing the scourge of this pandemic and its impact, but are we hopeful that we're now seeing a turn for the better, or are there fears that there is a lag in the post-festive season, travel and holiday season, the figures especially?
I think what you're seeing now, we can be quite confident about. We like to see at least 2 weeks or 14 days of continuous trend. And so when we look at the data we have right now on the cases, we reached our peak at close to about 20,000 cases, and I'm referring here to a 7-day moving average, on the 8th of January. Since then, for the last 14 days or so, we have seen a continual and systematic decline in cases, and that is occurring in most of our provinces. So we are now, from all the indicators we see, whether it's the proportion of tests that are positive, the admissions or the cases, we are now firmly on the downward slope. Okay. And that will take us over the next 2 weeks or so to the trough point that we would like to get to, a point where we call low transmission at below 5 cases per 100,000 per day.
Okay. Now, Prof, we also passed another COVID-19 milestone with more than 8 million tests having now been done. What is the strategic importance of this?
Well, part of the challenge that we grapple with in this epidemic is to ensure that we are testing enough people. Because if you don't test enough people, then you will be missing a lot of cases. The way in which measures whether you're testing enough people is that they would like to see the proportion of positive tests to get to below 10%. We are
all right, we're going to see
below 10%. It's very difficult because you've got so many cases. But now, as we reduce that proportion, our goal is to get to below 10%.
So we'll look at that connection between the low transmission point and vaccination. But I want you to listen to something quickly, very, very quickly, Prof. So at the end of the month, we're told that we're expecting our first batch of vaccine. But we spoke to Denosa earlier on about healthcare workers and training. Just please take a listen to this quickly.
I must say the pace of rolling out the training for our healthcare workers is quite slow, and I think I cannot bet and say any healthcare worker has been taken through the training as yet, and that is extremely concerning, considering that early in February is the time that the first rollout is envisaged to be beginning.
It's concerning that you say that you can't say at this point that any healthcare worker has been through training. Tell us why you say that. Are you saying that the training hasn't started, or it's not substantive enough for healthcare workers to feel confident in that they can administer the vaccine?
It has not started, and because healthcare workers are not feeling confident, and they are themselves having questions that they are asking, And to us, we've been concerned about that. If you remember, everybody is talking about the vaccination and is debating it, be it on social media platforms. So are healthcare workers. And it is quite exciting, and that we do have this opportunity, especially because healthcare workers themselves have been infected in large numbers.
How many hours of training? So you say it hasn't started, but you say they're not confident. So I'm still a bit confused. How many hours of training, if at all, have there been of healthcare workers in the administration of the vaccine?
None.
I'm asking how many hours? Have there been any, or have there been zero? Is that what you're suggesting?
There has not been any.
All right, so that is Denosa speaking to us earlier on. Professor Karim, can you confirm this, and are you concerned if this is the case?
So, the Department of Health manages the overall implementation. As a scientific advisor, our goal is to try and ensure that the highest priority populations are identified, and healthcare workers is highest on that list for the obvious reason that they are in a very high-risk situation, so they need to be vaccinated first. The process of doing that and the actual implementation, that's dependent on the government and how they process that. I'm not in a position to expand on that because I don't know those details.
All right, I understand that, but perhaps at a later stage we can talk then about the importance of the people who will be vaccinated first and their ability to explain to the larger public about, or should I say, their knowledge of vaccine administration. We've got a couple of questions coming.
No, it's a very important point you're making, because there will be a lot of questions that those being vaccinated will ask. And so, standardized, frequently asked questions and answers need to be prepared. Those who are giving the vaccines need to know what they're doing, how they're doing it. I mean, it's not rocket science. You put it in a vaccine, it's in a little vial, and you draw it out in the syringe and you inject somebody. So that's not rocket science. But what is important is that people must be able to get consent. They must know what they're doing. And I think that that's the point you're making, and that's quite correct.
Thank you, Professor. We've got questions coming through from our viewers. Let's go to the first one via Twitter. Emmanuel Khapola wants to know about people who use African herbs to improve the immune system. And I think the question overall is whether these people, I'm just imagining whether or not they can be vaccinated at the same time while they use African herbs or remedies.
What we do know is that people who ensure they eat a balanced diet will have, a perfectly fine and functioning immune system. There's really no need to take any medication or any supplements. I myself don't take any supplements. So just eating in a balanced way should be good enough. For those who wish to take additional supplements and those who want to take traditional medications or even, supplements you get in the pharmacy, there is none of that is a contraindication to taking the vaccine. There is no problem with taking a vaccine in the presence of taking those kinds of supplements.
So we've got another question here, Professor Karim, from Refilwe Rantlako. She wants to know about whether individuals will have to pay for the vaccine and how much it'll cost, whether it'll be free to all people. But of course, we know that there's no cost, but you can give us a little bit more detail on that. Jack Pagat wants to know about the role of Cuban doctors, where they are now. But also, Prof, he wants to know about what happens if the vaccine has side effects for South Africans. So what can people do? I know there has been talk of a database of reportage on that. Let's first start with the cost, and then we can talk about the role of the Cubans and, of course, what happens if there are contraindications that you spoke about or even greater adverse effects.
Right. So when we look at the vaccines that are being purchased for COVID-19, they're being purchased centrally by the government, and that makes very good sense because the last thing we want is a situation where, 10 people from South Africa are going to the same company and all of them are bidding for the same vaccines, pushing up the price. So it needs to be done in a much more coordinated and structured way. The vaccines, as far as I understand, are being provided free to anybody who is being vaccinated. The actual funding for it is coming out of the Treasury, and the medical aids are also contributing to the costs. So, but to the person receiving it, there is no cost at all. As far as the Cuban doctors are concerned, I'm not totally familiar with what they're doing, but as far as I'm aware, the last time that I knew, they were in the various provinces supporting the provinces in terms of providing medical care where it's needed, where hospitals are under pressure. There's also some of them who are epidemiologists and who are helping the provincial departments generate their reports and their information for planning purposes. And then finally, the issue of side effects. Any medication you take will have side effects. There is no such thing as a medication with no side effects. And a vaccine does have side effects. Most of them are pretty minor. They involve a bit of pain, a bit of swelling at the site of the injection, as you would get with receiving measles vaccine or any other vaccine for that matter. We have found, certainly with the 6 vaccines that have released their results, that the safety profile of the vaccines is really very good. So there is no reason to be concerned. If somebody does encounter a side effect, then there is a reporting mechanism that will occur through the person who injected you.
Professor Karim, why are you still on that?
Out and that's collected centrally in government.
While you're still on that, the Network for Genomic Surveillance in South Africa was giving a report back on what they find in patients' antibodies. They spoke about the fact that if they were less able to neutralize the new variant relative to previous COVID-19 variants in South Africa, what exactly does this mean for the vaccine? I mean, there's been a lot of talk about if we don't know what vaccine we're getting and this new variant, how it will react. So just take us very briefly through that report back from the scientists and the labs.
Oh, I'm very glad you asked that question, Sabiso, because there's been literally new information that's just come out yesterday that has really thrown new light on the subject. So what do we know? In the 44 people we tested at the National Institute of Communicable Diseases in a study led by Professor Penny Moore, they found that these 44 individuals, in their blood, they have antibodies from the infection that they had in the first wave. Those antibodies can kill the viruses we had during the first wave. But about half of them, the antibodies cannot kill and recognize the new 501YV2 variant. Now that's quite concerning, that natural immunity from the first wave is not able to protect from the second wave. What's the concern? The concern is that we may start seeing reinfection. Now, we do know that antibodies are not the only way in which the body fights this virus. And so fortunately, it looks at this point that the T cells and the antibodies together may be able to contain this new variant so that it's not leading to large numbers of reinfections. There are some reinfections that are occurring. They're currently under investigation, and we'll get a better sense of that in a while. But the new information, a paper released last week by Nussensweig and others from Rockefeller University, and a paper released yesterday by Wu and company from the Moderna team, both of them showed that in patients who've been vaccinated, their blood is able to kill the 501YV2 variant. So individuals who've received either the Pfizer or the Moderna vaccines, that their blood can kill this virus. There is no concern that the vaccine, those two mRNA vaccines, would not work.
So
we're now waiting for the AstraZeneca vaccine results, which are expected imminently.
That's some very exciting news and certainly gives us hope, Professor. Let's get more questions in, because I know some of our viewers want to know about this. So we've got a question now from Xolani Qobo, who wants to know about how long do you think at least the majority of South Africans will receive the vaccine, as in how long will it take us to get to phase 3 of the vaccination? That must be a tough one, because we say we've secured 20 million doses. We obviously need a lot more, but we don't know when we're going to get more, according to what the health department tells us at this point.
Yeah, I think there's a procurement team in the Department of Health led by Adrian Gore and others who are responsible for procuring the vaccine. So I'm not au fait with all of that.
Okay.
I would just say that if South Africa is able to vaccinate its healthcare workers and the key populations that are in phase 2, which is your elderly, the individuals with comorbidities and essential workers, if we can do that by the end of this year, that would be a major accomplishment, because that would mean that we would reduce the risk of hospitalizations. Remember, when you look at the data on the AstraZeneca vaccine that we are rolling out, the vaccine prevents a clinical illness. It prevents people to get sick and go to hospital. It doesn't prevent asymptomatic infection. You still get infected with the virus, but you just don't end up becoming sick and going to hospital. And that's really important, especially for old people. For young people, it's less of an issue, but for old people above 60, those with comorbidities, there it becomes an issue. So vaccinating them has to be our highest priority. And if we can just do that, that would be a major accomplishment.
So, Prof, more questions coming through. We've got one here from Dikwena, who wants to know on which category social workers are placed at institutions will receive the vaccine, because we only hear you talking about nurses, doctors and police, frontline workers, I'd imagine. So let's go to the next one. Okay, we've got several questions.
The Ministerial Advisory Committee on Vaccines, which is chaired by Professor Shu, has a whole work stream that has developed a set of priorities. And within those priorities, they've analyzed within the second phase that we would have the elderly, that's those above 60, you've got those with comorbidities, you've got those in congregate settings, and then you've got those who are essential workers. In each of those, there's a list of categories of who counts as essential workers, who counts as being in a congregate setting. So all of those, I don't know them offhand, but they are defined by the Ministerial Advisory Committee, and that's what is contained in the plan.
All right, we're taking your questions to Professor Karim to answer your questions on where we are in terms of the vaccination drives or the disease itself. We've got this one from Marlo. So Marlo wants to know about the symptoms of the variants and how it will respond to the vaccine. I think that part of the question we've already dealt with, but you can add to it, Doc. Let's go to the next tweet so that we can have as many tweets as possible. King Morena wants to know if, as we are in a rush to secure the vaccine, have the vaccine tested against South African variant? I believe it is not similar as Chinese COVID. The treatment will be different. So please answer this question as well, Prof, because I know you mentioned the new studies that are coming through, but how the studies against the UK variant, the Brazil variant, which I believe ours is more similar to.
So it just needs to be pointed out that there are many variants of the virus. Not all of them are particularly important. These variants become important when they start changing the key part of the virus called the spike protein, and where that spike protein attaches to the human cell. It's an area we call the receptor binding domain. So it's there that the mutations matter a lot. And also in another area called the N-terminal domain. So those are the variants that are really important. The 501Y.V2 variant is different from the original Wuhan virus in quite a substantial way. The original Wuhan virus changed quite rapidly into a new variant called a D614G. And D614G rapidly spread throughout the world. In fact, it spread quite quickly in Europe. And so when the viruses from Europe, you remember the first case we had that came from Italy, those viruses already had the D614G. So most of the viruses in South Africa already had that variant. Now we've got this new variant, which is very different. And what we do know is that at least the mRNA vaccines seems to be that they can kill this particular variant. We're just waiting for the results from the AstraZeneca trial, because what's being done is those who've been vaccinated with the AstraZeneca vaccine, their blood is being tested to see if it can kill this virus. So then we'll get that answer, and then that will guide you as to whether the AstraZeneca vaccine is fine for our variant.
Prof, there's
in terms of the symptoms, just to answer the question about symptoms, the symptoms and the signs of being infected with the new variant is exactly the same as the old variant. There is no difference in the diagnostics, in the prevention, and the treatment, or even the course of the infection. They are exactly the same.
All right, let's go through the last two questions before I ask you that question. That is pretty much in relation to the last question that was asked. Sipho Salim is saying that, is it true that the new variant is restrained against the AstraZeneca vaccine, and we have already bought over 2 million doses? And the last tweet says, from Boxper, saying, what about those who do not want to be vaccinated due to various concerns or don't see the need for vaccination? I think this is a very good question. Can we first start with that?
I mean, the previous question, the answer is no. There is no evidence to suggest that the AstraZeneca vaccine is resistant, that it's not able to kill the new 501Y.V2 variant. That's still being studied. And if I was to speculate and guess, I would estimate that it's quite likely that the vaccine will work, given that the other vaccines work against this variant. On the issue of whether vaccination is compulsory or whether it is voluntary, as it stands, the current approach is that only those who are willing to be vaccinated will receive the vaccine. So if somebody says, I don't want to receive the vaccine, that is their right, and they do not need to be vaccinated. That is the current way in which the rollout is occurring.
My final question is,
note that if you say no to receiving the vaccine, then there are certain issues that go with it. For example, you may not be allowed to fly. You may not be allowed to engage in certain activities, because by the time we get into the end of this year, early next year, that's going to become a requirement. Right. So you may not be allowed to go into high-risk situations unless you've been vaccinated. So it's quite important to think very carefully, and it's quite important to protect yourself and your family by getting vaccinated.
Very quickly, Prof, I do need to ask this question because you also raised the issue about how people with antibodies, or at least the tests that have been done for the AstraZeneca and Moderna, have been found to be effective, that they can kill the variant. But given the fact that we don't know at this stage as South Africa which vaccines we're getting, are we going to make our choices on the basis of that finding, for instance? And how does it work? Say, for instance, we end up getting 5 different vaccines. Do we still achieve herd immunity that way? Do we expect to then have different contraindications? How is that going to be managed, et cetera, et cetera? I think you know where I'm going with this.
Absolutely. So I think South Africa set quite a laudable and challenging goal of trying to vaccinate 2 out of every 3 people in our country. That's quite a high bar. It's not going to be easy to achieve. It's going to take a long time to achieve it, and it's going to be a mammoth task to achieve it. It does not need to be a single vaccine. We can choose 5, 10, doesn't matter, however many vaccines. What we do want is to choose vaccines that are highly efficacious. For example, if we're choosing a vaccine that's not highly efficacious, then it means we have to vaccinate many more people in order to get 2 out of 3 people with protection. So as long as a vaccine is highly efficacious, and the Ministerial Advisory Committee has set criteria, there are 5 key criteria that are used to determine whether the vaccine meets the threshold. If it does, yes, we want to use that vaccine. And right now, we cannot expect that we'll get only one vaccine because there isn't a supply like that. So we have to take whatever mix and match of different vaccines that we get, and each person needs to be vaccinated. As long as that vaccine meets our threshold, it's as good as any other vaccine.
The end goal is more important. Always a pleasure. Thank you so much, Co-Chair of the COVID-19 Ministerial Advisory Committee, Professor Salim Abdool Karim.